And we're back with Dr. Tim McKnight this morning, and good to have you in here. I thought I heard the bell ring, but then I wasn't sure if that was the bell or my ear.
Oh, there you go.
There, we'll lead into that. We wanted to talk a little bit this morning, or I guess I was asking about tinnitus, which people commonly refer to. There's a ringing in my ears, and it won't go away.
Yeah.
So that happens to a lot of people, I think.
That's probably 10 to 15% of the population have it. So it's the perception of sound when there's no corresponding external sound present. So you think you're hearing something that's not there. And everybody will experience a faint sort of a normal tinnitus or ringing. And nearly everyone will feel that sometimes in a completely quiet room. But it's only a concern or bothersome when it interferes with your daily life, when you're hearing it when you don't want to hear it. So it's often described as a ringing sound, but it can also sound like a clicking or a buzzing or a hissing sound or even a roaring sound. And it can be soft or loud or low or high pitched, and it often appears to be coming from one or both ears or from inside the head itself. And some people, the sound can interfere with concentration and focus, and in some cases it can be associated with anxiety and depression.
Sleep, I would imagine it can also bother sleep.
Oh, absolutely. Yeah, you have a hard time falling asleep, and it's often associated with a degree of hearing loss. So they actually say that musicians and DJs are more prone to it. Anybody that's got a lot of sound noise that bothers the ears, it can damage the ears. So people who have hearing loss will particularly be prone to develop this.
I experience that once in a while. I think I'm lucky I don't have it all the time. Does this have to do with the tiny bones that are in there? That's how you pick up sound, right?
Yes, it can. You have the eardrum, which actually vibrates just like a drum would, and then you've got three bones that pick up those vibrations, and they vibrate, and then that's transmitted, I think it's to the cochlear nerve that then goes to the brain where you interpret the frequency of sound, and you interpret what sound means. So if those bones sometimes can get, they can stick or they can get sclerotic, meaning almost like an arthritic joint where they don't move, that can be part of it. And that can also be a part of the hearing loss that we see. But I noticed I had a pretty bad respiratory infection last week, and this morning I was having a hard time hearing out of my right ear, and I was having ringing in my ears. I was just quiet, and I'm like, I can hear that ringing sound. It was in the right ear, the ear that's the most plugged up ear. Mm-hmm. So, but it's gone away. I mean, if I sit there and think about it, I can hear it. But most of the time, you just ignore it and it'll go away. But that's an upper respiratory infection. But there's other things that can cause this. There's a condition called Meniere's disease where you get a high pressure of fluid in the semicircular canals where the balance is part of the eardrum or the inner ear, the balancing mechanism. So that's a completely different situation. You can get tumors on the nerves themselves, acoustic neuromas, and those have to be diagnosed with an MRI and with hearing tests. So a lot of times these conditions require patients to see an ear, nose, and throat specialist where they can do the hearing tests. They can decide if an imaging study is needed, an MRI or an MRA looking at blood vessels in the ear. Some people will notice when they lay down on their pillow at night, they can hear a whooshing, a pulsating sound. That's actually an artery close to the eardrum that they're picking up those vibrations. And that can be bothersome or concerning, but it usually doesn't mean anything.
You don't want that to stop.
Yeah, you want to continue hearing that. But most of the time you can't hear that. Every
right.
now and then you can pick that up. So, there's the treatments are, well, a couple of the other causes. There are certain medications that can predispose you to this. The one we normally think of is aspirin. So that's an easy one. If you're taking aspirin, stop it and give it a couple days, see if the situation goes away. But loop diuretics like Lasix or furosemide can cause this. There's certain antibiotics that can cause it. And there's certain antipsychotics that can cause it. So if you eliminate these medications, sometimes the symptoms will go away. But for the most part, for most people, it doesn't last long. It's just temporary. Mm-hmm. So the prevention always is protecting your ears from a lot of loud sounds, wear earplugs. And then if you're having issues with it, seek medical attention. And usually you'll start with your primary care provider. We'll go over the list of medications. We'll look in your ears. Sometimes just having earwax in the ears can cause this, so we can clean those out. But if there's concern, there might be something more involved, especially if you're having a sense of vertigo or just a spinning sensation. That can be a sign of this inner ear condition called Meniere's, and that can require a different approach, and sometimes we need specialists to help us with that. So I guess the bottom line is start with your primary care provider, and if it's really bothersome, you might need to be referred to an ear, nose, and throat where they can do these more sophisticated tests and help you figure out what to do with it.
There's really not a medication to cover that up. It's more about maybe taking away a medication which might be causing the noise.
Yep. It's about taking away a medication, and then we call it white noise. Try to find something that's soothing to listen to, especially at night, that sort of distracts it.
I hear a lot of people that run fans at night no matter what the temperature is. That's what they're doing, I assume?
Yes. So a lot of people do that. I think there's a lot of nice apps on the phone.
Or I was going to say fan noises.
Yes, anything. Any type of noise. You listen to the surf or nature, or there's all kinds of apps to help you sleep. But anything like that doesn't bother you. A fan annoys the heck out of me. But if I listen to the surf or rain, that's soothing for me. So I couldn't use an app or a fan.
Not like when. Way to go, Dr. McKnight. Not that kind of fan.
Yeah, no, that wouldn't. I'd please sit down and stop the applause. It wouldn't work for me.
Probably not.
It's a common problem. It's really it can be really disabling for people. I have people come in the office and they just go nuts with it because they can't get it to stop. Yeah. And those are fairly rare when they're that severe. But we do our best to help them look in the ears. But that's why we have the specialists to help further.
And I'm assuming, like you said, any condition involving the ear, this might be a side effect. Anything that might be going wrong.
Sure. Yes. So hearing loss, earwax, and ear infection, a change in the pressure in the ear canals from an infection or upper respiratory infection like I've had, or just we call it labyrinthitis, where you get this extra fluid and pressure in those semicircular canals that are there to help you with balance. That can do it. There's a lot of reasons that we can have issues with this.
When you're at altitude, it changes the pressure of your ear. Might that be a temporary onset?
Yes. In fact, I think I was actually on a plane landing Sunday, and I had a lot of pressure in that right ear. Mm-hmm. Normally, if I yawn or open my mouth, I can equalize the pressure, and I couldn't do it. And I thought I was going to pop my eardrum. It was pretty painful. And it wasn't until I blew my nose that I could feel that pressure leave. But that's why that pressure change is what I think is probably the trigger for the tinnitus that I have right now. And it'll go away. In fact, right now I don't hear it. But if I was quiet and not talking, I probably could hear it. But you ignore it and you clear that infection up, and it gets better.
All right. Well, we are glad to have you back, although we had an encore presentation with you last week.
I hope my encore presentation was better than the first round.
It seemed oddly similar.
Yeah. It's nice to be able to have that on those days. I was miserable. I was, congested and coughing, and I'm glad. It's amazing that the body can heal itself. You give it a few days and things get better.
It does well.
It's pretty wonderful.
Get us, if you will, a quick update on Fit for Life. How's that going this
time?
Yeah,
we had to postpone it last week because I was out, but we're week 7 week 7. This is a fun week. This is actually on food labels. So we've talked about foods that make us sick and foods and nutrition that help us heal. And now this is sort of the applied nutrition. Let's look at a food label and let's decipher based on what we're reading what's good and what's bad. So the people really, it's the application of nutrition. Yeah. It's kind of fun. And then from there we'll move on to next week we'll move on to flexibility, then cardiovascular fitness, strength conditioning, and then we'll go into hormone replacement therapy and just disease prevention in general. And then we'll wrap up with our 12th week. So we're right in the midst of it. We're doing great. We have a lot of people that listen virtually online, and they're doing really well. I talked to one of them yesterday. And so it's great that people can still get something out of this without being there personally. Yeah. So we just have a blast with it. We're filling up for next year already for January.
Wow.
We've got people. The Dover Libraries offered us the same location, and it just seems to be snowballing. And I'm just so shocked. After 16 years, we're still reaching new people we've never seen or heard of before.
Yeah, there's a lot of us living unhealthy lives that need to have that help. So we thank you for that. Thanks
Well,
for being
it's
here
fun.
today, too.
Oh, you're welcome.
All right, we'll talk to you next week. Dr. Tim McKnight this morning as we talk with the doc.